Hello and welcome to our presentation entitled Shift Work Disorder in Primary Care, Improving Diagnosis and Management. I am Dr. Paul DeGramji, family physician at Collegeville Family Practice in Collegeville, Pennsylvania, and medical director of health services at Ursinus College, also in Collegeville, Pennsylvania. With me today is Dr. Carl DeGramji, professor of psychiatry, neurology, and medicine at Jefferson Medical College, Thomas Jefferson University, and medical director of the Jefferson Sleep Disorder Center, Thomas Jefferson University Hospital in Philadelphia, Pennsylvania. Hello, Carl.
Paul.
Today we'll be discussing the diagnosis and management of shift work disorder in primary care. And Carl, before we do that, we have to look at the circadian timing system. What's normal? And it all begins with the suprachiasmatic nucleus, doesn't it?
Correct. The suprachiasmatic nucleus is in many ways a master clock, which basically controls a number of different rhythms in the body. And sleep and wakefulness is really one of many other rhythms, as we can see in the slide. There are rhythms for hormones, glucose metabolism, cognition, and even body temperature and heart rate. And these rhythms occur on a 24-hour basis and are called, therefore, circadian rhythms. They have to be timed not only with respect to the environment, but also with respect to one another. And this timing is intricately controlled in many animals, as well as humans, we think, by the suprachiasmatic nucleus.
Excellent. And we have variations throughout the day then in a nice 24-hour rhythm, such that in the mornings there is a decreased blood pressure. In the evenings there's decreased blood pressure, but in the mornings there's peak levels of blood pressure, but also adrenaline, cortisol, testosterone. All these things happen in a 24-hour rhythm, and there's, again, increases and decreases, all governed by the suprachiasmatic nucleus.
Exactly.
Now, the biological clock, there is synchronization and entrainment. And the first slide showed this a little bit. What about the effects of light and melatonin?
Well, the underlying internal circadian rhythms that we have are not necessarily 24 hours long. In fact, some of these rhythms are 24, 25 hours long, and some maybe even have a greater length or cyclicity. It's important, therefore, for these rhythms to be timed with respect to one another. And one of the ways in which that timing is accomplished is through light. So light essentially entrains or synchronizes these rhythms so that they occur on a 24-hour basis, and also entrains them not only to the environment but also to themselves, or with respect to themselves. Now, one of the important signals in which the suprachiasmatic nucleus makes the light signal known to the body is melatonin. And melatonin is secreted by the pineal gland, of course, as we know. And that signal is transmitted throughout the body so that all of these various clocks become timed with respect to one another.
So both melatonin and light are very important in training this 24-hour cycle that we have. And they are going to then be techniques then that we have, and we'll discuss later on how we can manipulate a 24-hour clock, especially if it's broken, using melatonin and using light. Carl, shift work disorder is when one's circadian rhythm is broken, when things are going wrong. And there's sleepiness, and there is wakefulness problems, and even insomnia, isn't there?
Correct. And when those two problems occur, insomnia and daytime sleepiness, in a shift work situation, we know that the potential for shift work disorder has become high. That is, people become less adaptive to shift work, develop difficulties functioning on the job, and also difficulty with sleep. We know that the level of sleepiness during the day is controlled by this biological clock, but also by another factor called the homeostatic factor. And that's really a factor which depends upon how much or how little sleep we've had in previous day or week or even months, so that we can become extremely sleep deprived and become very sleepy during the course of the day. And these two factors, the homeostatic factor as well as the circadian factor, are the two critical factors which determine in many ways the insomnia as well as sleepiness of a shift worker.
So the homeostatic sleep drive, again, the longer we're awake, the drowsier we're getting. At some point, we have to get rid of the homeostatic sleep drive by sleeping. And then we, of course, have the circadian alerting system, which can help as well. And when they're broken or when we misalign them, that's when we can have the drowsiness. Exactly. And we can have the insomnia issues. Well, Carl, here's a case that I'd like to present. And this is one where a woman who is 41 years old, she comes to my office because of routine follow-up. She has had deep vein thrombophlebitis in the past, and she takes warfarin. So let's see what happens. Hi, Janet. How are you doing today? You seem tired.
Oh, I'm okay. I just got off work and I haven't had a chance to sleep yet.
Well, what times do you normally sleep?
Well, during the week when I'm not working, I usually go to bed around 10 or 11 at night and wake up around 6 to make sure the family's ready for the day. But on the weekends, I work from 11 at night to 7 in the morning, so I try to catch up on sleep when I can. But it's hard with the kids and my husband. They have too many activities and there's too much going on.
Do you have any trouble staying awake while you're working?
Every night. I drink a lot of coffee and take some energy drinks, but it's still hard.
Oh, and what about your driving? Do you have any trouble staying alert then?
Yes, especially driving home from work. I've been lucky a few times and didn't have any accidents. Maybe I should get one of those cars that beeps when you go out of your lane or stops automatically when you're about to hit the car ahead.
Well, we'll talk about that in a second, but what's your family life like?
What do you mean?
Well, I mean, are you able to do everything you want to do and need to do? What are your relationships like with the husband and children?
Well, things could be better. I have trouble concentrating sometimes, and I forget to do some things. My husband helps somewhat, but I can be pretty irritable with him and the kids. I get annoyed pretty easily. I'm glad my husband can put up with me. The kids, they also try to stay out of my way on the days after I work.
All right. Well, do you take anything to help you sleep at all?
On the weekends when I'm working, I'll take a Benadryl or drink warm milk. I bought one of those white noise machines to help drown out the noise in the house. These all help a little, but not much.
All right. Now, Janet, do you snore? Does your husband complain about you snoring at all?
I don't think I snore. My husband would definitely complain if I did, because I complain about him all the time.
Okay. Well, here's a brief survey. It's called an Epworth Sleepiness Scale that I'd like you to fill out. It only takes about a minute or so, and just go ahead and do it. It's an 8-point questionnaire that asks you what are the chances of you dozing off from 0 to 3, 0 meaning you'd never doze off, and 3, high chance of dozing off, and 1 and 2 in between in these normal life situations. Go ahead and put a number down, and I'll add it up for you.
Here you go.
Okay.
How'd I do?
All right. Well, we'll talk about this in a minute, but first, let's go over your medical problems, okay?
Okay.
All right. So, Carl, clearly we have a case of a woman that comes in for a medical problem, and easily we see that she's tired, and her tiredness has to do with doing a night shift. There are many people in this country who do night shift or rotating shifts, aren't there?
It's striking, Paul, that 26% of the U.S. workforce is involved in shift work. And these folks are working all sorts of different shifts: night shift, day shift, variable work shifts, and even PRN work shifts, meaning they're on call on an as-needed basis. And this kind of disruption in sleep-wake rhythms puts them at prone for shift work sleep disorder. She's in the healthcare industry, and we know that the transportation industry, as exhibited on the slide, has the highest shift work contribution. But healthcare workers, such as you and myself, and
yes.
other physicians and residents in particular, and interns and nurses, are very vulnerable to developing shift work sleep disorder.
Remember those times when we were on call? It wasn't much fun, was it? All right, well, to make a diagnosis of shift work disorder, here are the criteria. Insomnia and or excessive sleepiness, which that is temporarily associated with a recurring work schedule that overlaps the usual time for sleep. And the sleep-wake disturbance causes clinically significant distress or functional impairment, and the symptoms are associated with the shift work schedule over a course of 1 month or longer, and the evidence of disturbed circadian and sleep-wake time misalignment is documented usually with a sleep diary or a sleep log. And in this case, in the video, we just did just asking questions about sleep, a sleep history. Now, the impairment associated with shift work disorder are quite a bit, aren't they, Carl? It's not just sleepiness. There are many other things that happen as a result of doing shift work.
And we used to think that sleepiness and insomnia were some of the unintended consequences of shift work. However, recent research is beginning to show us that there are a number of other metabolic, physical, and psychological disturbances associated with shift work, including what we see on the slide: GI disturbances, cardiovascular dysfunction, stroke, and cancer. Long-term shift work is associated with stroke and cancer. We also know that it contributes to the potential for depression and ulcers as well. So we don't quite understand how all of this happens, nor do we understand whether stopping shift work can improve some of these consequences, or all of them. But we do know that there are definitely comorbid disturbances with shift work.
And these are quite sobering. I mean, if you look at this, Carl, increased chance of cancer. I believe it's breast cancer in women and prostate cancer in men. And stroke, the study seen with nurses. I mean, it's not just being drowsy. Again, there's a lot of morbidity and even mortality associated with doing shift work.
Exactly. You can see in this next slide, Paul, that these were individuals who were actually made to do shift work, who were not originally shift workers. And they were brought back to a situation where they were normalized, essentially, in terms of sleep-wake habits. Some of these individuals did not adapt correctly or adequately, and those are depicted in this slide in the yellow lines. Those folks, compared to the folks who did adapt or even did not engage in shift work, had a much greater degree of mood disturbance, mental fatigue, and performance decrements. And as you can see in this next slide, these the individuals who actually engage in shift work, the next slide actually, individuals who engage in shift work have a greater tendency to have accidents, both on the job as well as after leaving work, auto accidents in particular. In addition, when you go to the next slide, we can see that shift workers have a higher tendency for depression. And that tendency seems to be highest in individuals who are engaged in night work as opposed to rotating shift workers and day workers.
So there's more depression in these patients, there's a lot more accidents, but also, again, in this study, we were able to see that when you entrain somebody, or when you help them entrain, it may lessen. So again, it speaks of what's coming on later on, which is we can help these patients with shift work disorder.
What's also striking about those data is that they suggest that some people can adapt to shift work, whereas others cannot. So the adaptation to shift work and the vulnerability to it differs between individuals, possibly for genetic reasons.
We'll talk about that a little bit more when we talk about the diagnosis and treatment. So when do we suspect or screen for shift work disorder in primary care? And Carl, this was a routine visit where this patient came to see me for something other than tiredness, etc., but she clearly showed it. But then we also, and it was a specific complaint that occurred as a result of my asking about it, but also work-related complaints, patients coming in saying to me they're tired, they can't function on their job, or maybe they're even in trouble with certain performance issues on their job. Possible comorbidities. We saw earlier about cardiovascular disease, we saw stroke, we saw cancer. So if these patients are coming in, we probably should be asking them about what kind of work that they do and if they do have rotating shift or night shift. And finally, and I think this is really important in primary care, when patients come in for a routine visit, we certainly ask them whether they smoke, whether they drink, and what occupation they do. And if it's prompted, the occupation may suggest to us that these patients could be doing shift work. For example, a person that comes in saying, I'm a nurse, we might want to ask them, do you do any night shift? And it may then prompt conversation to us whether this patient could be suffering from shift work disorder. All right, so during a visit for possible comorbidities, GI disturbances, metabolic disorders, mood disorders, etc., ask what are your sleep times, ask what are your work hours, and ask what are the sleep times on your day off, right, Carl?
And it's an important slide. How often, Paul, do we ask, what are your work times? It's not something we ask very commonly. And a patient who's in our office seeing us, who's falling asleep, may actually be scheduled to sleep during those times because he or she may be a shift worker.
Sure. So when they come in with some of these, ask at least a couple of screening questions. And if they screen positive, some additional questions that you may want to ask is, well, do you have difficulty sleeping? How often do you feel tired or sleepy at work? Do you often struggle to stay awake? So these are some of the other questions that we should ask. So a couple of questions, screening questions, and then after that, more questions should be asked to understand exactly what's going on with a patient's sleep-wake pattern.
Absolutely.
Okay, so maybe an algorithm here, an approach to the diagnosis of shift work disorder. Somebody coming in with insomnia or excessive sleepiness. One of the things that we should know is that insomnia isn't always insomnia. Insomnia could certainly be as a result of a shift a shift work situation. So ask a patient what's going on with their occupation. So a sleep-wake history is then in order. Ask about medical and psychiatric conditions. Ask about social and maybe even a medication history. We should not forget about medication history. Then a brief physical exam that's of course geared towards what's going on with the patient. Diagnostic studies are usually not necessary about these patients that are going on. We'll talk maybe a little bit later about actigraphy, but diagnostic studies aren't necessary. Then we have our differential diagnosis, and then of course the shift work disorder diagnosis is made. Carl, let's talk about something called an Epworth Sleepiness Scale. It's a neat little tool that we have in practice where we can understand how tired somebody actually is, isn't it?
And whenever we ask our patients, how tired do you feel? It's very common that they may say to us, not very tired at all. But yet we may actually see them falling asleep in the waiting room. So the Epworth Scale is a very good inventory, validated inventory, which helps us understand the degree of sleepiness that an individual may have. It takes about 2 or 3 minutes to fill it out and maybe a few seconds for us to score this. And a score of greater than 10 is considered to be abnormal. And essentially, as you can see, the scale rates how likely individuals are to fall asleep during situations of everyday living. It's also a nice scale because it helps us understand how our treatments might be helping people to improve in terms of their alertness to various therapeutic maneuvers.
So we can actually do this to understand if a patient's tiredness is really sleepiness, how sleepy they are, and if we institute treatment, then find out how well they're doing. Carl, it's interesting in this Epworth Sleepiness Scale, though, what we're asking them in these normal life situations, these are situations where they're inactive, aren't they? We're not asking them how drowsy are you when you're running or jogging or when you're having an argument with somebody. You're asking them, what is your chance of you dozing off when you are sitting and reading, lying down in the afternoon, while you're a passenger in a car? And that's what we really need to know. When we ask somebody if you're tired, ask them if you're tired in passive situations, not in active situations.
And that's an interesting point because activity can certainly mask underlying sleepiness, but it doesn't get rid of it. And that sleepiness, of course, is interfering with the functioning of many of our patients, despite the fact that they may be actively trying to remain awake.
Okay, and in this patient that we had, Carl, we actually do an Epworth Sleepiness Scale, and we find out how well she's doing, that she actually does have a certain degree of tiredness, and then we manage her situation. Let's take a look a little bit more. All right. Well, Janet, you're doing very well with your medication. Your INR is staying in the right range. Everything looks fine. Now, I'd like to briefly discuss the tiredness. The survey you filled out, it indicates that you suffer from excessive sleepiness. And based on the survey and your description of your work and home life, I believe you have shift work disorder.
I can't afford to stop working, and there's no other job available right now with the day shift.
Well, you don't have to stop working, but there are a few things you can do to help you stay alert. First, here are some strategies to help you offset your sleepiness. It's called a sleep hygiene, and it reduces your risk of accidents and makes you more alert because you sleep better. And if these don't work, then you can come in the next time. We'll talk about a prescription to make sure that you are more alert while working, and especially that you don't nod off while driving.
Thanks.
So, Carl, I diagnosed her with shift work disorder, and I gave her some sleep hygiene methods and asked her to come back to help her sleep better, and perhaps it could even translate to improved daytime alertness. What do you think?
I think it's great for us. I think that's a great start, Paul. I think there are a number of other things which we could be doing, actually, to improve her alertness and improve her sleep. And we're going to get to that. But before we do that, I'd just like to point out that in order for us to become comprehensive in our evaluation, I think it's important for us to also rule out some other things that insomnia and sleepiness could be related to.
Right.
And this slide speaks to some of those things. For example, sleep apnea syndrome. A person who's sleepy and who snores a great deal, has breathing stoppages, should be suspected of that.
Right.
Certainly people with depression can present with sleepiness as well as difficulty with sleep. And many people simply do not obtain sufficient sleep, may get 2 or 3 hours of sleep at night and be sleep deprived. And we, of course, know that restless leg syndrome or an unusual motor as well as sensory problem in the lower extremities can contribute to these things. So I think a good comprehensive evaluation is a first step before we start treatment. But assuming that we are now progressing to treatment, as we see in this next slide, there are a number of different strategies that we can undertake. You've already talked about sleep hygiene, which is a critical cornerstone of any treatment process for sleep disorders. But secondly, education, and we'll talk about that in a second. Adjusting work schedules, which may or may not be possible, as you know, in this group of patients. Planned naps, which can improve daytime alertness as well, or nighttime alertness, and timed light exposure. And finally, pharmacologic agents can be critical in terms of getting rid of some of the daytime impairment as well as the insomnia. Now, let's talk a little bit about each of these if you'd like. Paul, you've done sleep hygiene. Do you have any comments on this?
Well, the sleep hygiene the sheet of paper that I gave her, I give out to my patients, and I think it's a nice idea. I probably would have done better to go over them in detail with her. Maybe the video just didn't allow time to do so. But nonetheless, patients need to know what are the important things about sleep hygiene. Adequate sleep time. You have to spend the right amount of time sleeping. And I guess about 8 hours is about right, wouldn't you say?
That's about the mean, 7.5 to 8 hours. Of course, as you know, there's a great deal of variability, but that's really a minimum.
And in her case, if she gets adequate sleep time and she does some of these other things, avoiding alcohol, heavy meals rather, nicotine, and while in bed, making sure that it's most comfortable and amenable for sleep, hopefully she'll sleep the best, translating to also the best daytime alertness.
Exactly. And a point I think that you made, Paul, already is that it's not so much how much you sleep, but also the quality of your sleep. And this slide speaks to that. That is, making the bedroom as dark as possible and making it as noise-free as possible can be very important in terms of improving quality of sleep. But I think in terms of education, we must really educate our patients that shift work is something that can really harm them. And we have to educate them that they have, by adjusting their behaviors, they can really help themselves adapt to shift work. So minimizing the differences in timing of sleep between work days and non-work days is critical. So if a person, let's say, is working nights and sleeping days, if they can also during the weekends try to see if they can sleep during the day as opposed to night, that might be helpful for some people. Minimizing overtime. We know that people who work more than 12 hours a day really cannot adapt well to shift work. And also sufficient time off. People who work three or four days per week rather seem to do okay. But people who work 7 days a week or 6 days a week seem to have a greater vulnerability to shift work if they take that overtime and have no time off to recover and recoup.
You know, Carl, there's a slogan in one of the advertisers that goes, "An educated consumer is our best customer." So educating our patients to what's going on with them, why we need for them to perhaps do all these things that we want them to is so important for their overall health. But you know, one other thing that we kind of have to talk about as far as shift work treatment is not doing shift work. I mean, there are some people that we want to urge them not to do any shift work at all. Isn't that correct?
Regrettably, I think you're right. As we mentioned before, genetic vulnerability is an important aspect of shift work adaptation. And some people simply cannot adapt to shift work. Of course, in all fairness, we need to try whatever methods are available to us to improve their adaptation to shift work. But some people simply cannot tolerate it. And of course, as we age, the ability to tolerate shift work schedule changes becomes less and less likely.
Do increased comorbidities also increase the probability of somebody developing shift work disorder? You said age, for example, is one of them, and our genetic tendencies. But what about increasing comorbidities? If somebody has more ailments, are they more prone to have shift work disorder?
Without a doubt. As you well know, psychiatric disturbances, medical disturbances, and intrinsic sleep disorders, such as sleep apnea syndrome, diminish the ability to adapt to shift work.
Okay.
In terms of your point about education, Paul, I think it's important to also note that we need to educate the family. Many family members need to become participants in the patient's sleep hygiene. So, for example, not intruding on the shift worker who's asleep, making sure the telephones are turned off, and that person's sleep time is well protected is important.
Yeah, so when they come home, let's make sure they get into their bed and they sleep, and don't disturb them to get them have that nice chunk of sleep. Now, as far as sleep goes, we always talk about napping. Is napping good? Is napping bad? For shift workers, it can actually be a good thing, isn't it?
We know that insomniacs we should not nap a great deal, primary insomniacs. But individuals who shift work, studies have shown, if they take a brief nap before coming into work or during work hours, such as during their lunchtime, can actually have a diminution of sleepiness, i.e. an increase in alertness, and their performance even improves, which is very interesting. Now, one thing about napping we have to make sure shift workers watch out for is the phenomenon of sleep inertia, where if an individual takes a nap and wakes up from the nap, he'll feel like sleeping longer, and his performance will be impaired for about 10 minutes after waking up from the nap. So, shift workers who nap need to start doing their performing or their work activities about 10 minutes after waking up from their naps.
So an ideal nap is about 20 minutes up to an hour. Much more than an hour is not a good idea, is it?
I think so. I think more than that would be counterproductive.
So we really want to recommend that if a patient has a shift that they're going on, let's say 11 o'clock at night, perhaps they can take a nap between 9 and 10 o'clock at night, but then have that hour or so or longer for them to get rid of that inertia and have them get ready for their work situation. And as a result of this, and as a result of, let's say, getting rid of a little bit of their homeostatic drive, they're getting rid of their drowsiness, they can be more alert and fewer accidents, and better things can happen during their shift. Timed light exposure. We talked in the very beginning that light is such a good idea in improving alertness, isn't it?
We know that bright light helps us resynchronize various underlying biological rhythms. And by using bright light, artificial light in this case, at specific times of the day or night, we can actually help shift workers adjust these rhythms. So studies have shown that bright light administered during the work schedule or before coming into work can be helpful in terms of adapting to shift work. On the other hand, and the corollary of this is that darkness just before going to bed is important as well to be able to set the stage for upcoming sleep. So shift workers who commute home in the morning may be well served by wearing sunglasses which protect them from too much bright light. And that sets the stage for them to be able to actually go home and then fall asleep and stay asleep.
So not just maybe light therapy, but dark therapy also. Just timing the light appropriately for our patients. Carl, you talked about light before they go to work, but it's also critical for them to be as brightly lit at their workplace, isn't it?
We know the phototherapy lamps during work schedules, bright light phototherapy lamps could be helpful. And we may also mention that light can have side effects, as you know, so we should make sure that these bright light boxes are not given to people with intrinsic eye disorders, patients who also may be taking photosensitizing pharmacologic agents.
Okay. Well, speaking of pharmacologic, let's go back to our patient here. As you can see, she comes back 3 months later, and let's see what's happened with the sleep hygiene methods that I've asked her to do. Let's take a look. So, Janet, how are you feeling? Have you been more alert with the strategies we discussed?
Well, they seem to help a little, but I still get sleepy at work and when driving home. Isn't there a sleeping pill you can give me to help me sleep?
I don't think you need something to help you sleep. I think it would be better if you consider something that would help to improve your alertness. Now, I can prescribe a medication that can do this and it won't interfere with your sleep. And I want you to take this medication as prescribed, of course, and remember to keep following the sleep hygiene approaches we discussed before. You should call me if you have any questions or problems, but I especially want you to call me next week and let me know how the medicine is working for you.
Okay.
And when you come in for your checkup next time, we can talk about all this further. So, see you next time, all right?
Thank you.
So, Carl, Janet comes back, and the sleep hygiene methods have not really been that useful for her as far as improving her daytime alertness. So I talk about medication to improve alertness. However, you said earlier that we probably could have maximized some other methods of therapy like light and dark therapy and even melatonin, right?
Admittedly, there's a lot that we can do for shift workers well before we go on to pharmacotherapy. And as this slide shows, the melatonin has been shown to be effective in terms of improving sleep in a number of shift workers. The studies regarding dosage have not been that clear. Some studies have used more than 5 milligrams, some less, but it seems like most studies have used about 3 to 5 milligrams, about an hour or so prior to bedtime. Of course, bedtime is in the morning for some of these shift workers.
Right.
And they have to take the melatonin on a continuous basis. But melatonin may be helpful in terms of helping them adapt the sleep-wake rhythm. And remember, we spoke already that melatonin is an important signal for the rest of the body's circadian rhythms. And therefore, we may be giving that signal to the body by administering melatonin to these patients. Bear in mind, the side effects of melatonin have not been well explored. It's not indicated by the FDA for this specific purpose, but it is relatively well available without a prescription. A number of other people have utilized hypnotic medications, as you know, sleeping pills. And although sleeping pills have not necessarily been shown to enhance alertness, certainly in insomniac patients and patients suffering from insomnia, they may help with sleep. And I believe you employed that strategy with this patient, if I'm not mistaken.
Well, again, she wanted to have a sleep medication used. And what I said with her is that we really wanted to concentrate on her alertness. So even if I had used something for her sleep and may have improved her insomnia, that wasn't going to translate to improved daytime alertness, was it?
Well taken. The studies have not shown that improved alertness is a consequence of a treatment for night shift workers. And as you know, there are many, many different kinds of sleeping pills, some with shorter half-lives and others with longer half-lives. And I'm not quite sure what your philosophy is, Paul, but generally speaking, I try to use these shorter half-life medications for people who have difficulties primarily in falling asleep, whereas maybe some of the longer or intermediate half-life medications may be more appropriate for people who have sleep maintenance difficulties.
Well, certainly we don't want to use any sleep medication that works longer than the desired sleep time. For example, if a patient comes home and they're sleeping from 9 o'clock in the morning until 1 or 2 o'clock in the afternoon, we don't want to use a medication whose half-life or its effects go to 6 or 7 hours or even 8 hours. So we want to just help them with their issue with sleep. And yeah, Carl, I mean, I think that using a short-acting medication to help you get to sleep. But again, keeping in mind that that's just going to help with their insomnia symptom and nothing else. And we talk about, the adverse effects of melatonin and adverse effects of sedative hypnotic medications. We have to keep these in mind when we prescribe any medication. I mean, speaking about medication, it's not a medication, but we have caffeine that can be helpful. I mean, in a lot of patients, we do tell them that timed caffeine usage and appropriate caffeine usage is pretty effective for their alertness.
Exactly, a widely available stimulant, and we have to regard it as a stimulant, really. The important point, I think, as you mentioned, Paul, is strategic consumption. Strategic consumption. That is, the amount of caffeine and the timing of the caffeine are important. So, the studies have shown that about a third of a cup of coffee, approximately, consumed per hour may be helpful in terms of increasing alertness and increasing performance on the part of shift workers. Now, if that is given too close to bedtime, there's where sleep difficulties can ensue. Mm-hmm. So maybe 4, 5, 6 hours prior to bedtime, maybe the latest dose, if you will, of caffeine. And we have to, of course, remember that caffeine can also have side effects. For example, dizziness, irritability, nausea, nervousness, and some people can get habituated to the effects of caffeine.
Yeah, but Carl, there are many different types of caffeine-containing beverages. There's coffee, then there's coffee,
right.
And then there's tea, and there's chocolate, there's sodas. What do we tell our patients?
I think if we mention to them about a third of a cup of coffee per hour, in this case, I think that boils down to roughly 20 milligrams of caffeine or so. Many sodas have about 50, 60 milligrams, so maybe a third of a cup of a glass of soda per hour, maybe just the right amount.
And starting about an hour before they start their shift, right?
To make sure they adapt when they come to work.
Yeah. Okay, now, as far as caffeine goes, it can be very effective. But then I talked to this woman, Janet, about prescription medication. Currently, there are 2 medications, modafinil or armodafinil, that are indicated for the excessive sleepiness of shift work disorder, right?
Correct, and these medications have actually had the most extensive clinical trials in terms of this disorder, shift work sleep disorder, at least the sleepiness associated with this disorder. And as we see in the slide, in the case of modafinil, the dosage used was 200 milligrams a day just before coming to work or coming onto the work shift. It was pretty well tolerated, and of course we have to remember both modafinil and armodafinil are Schedule IV agents, so there is some misuse or abuse potential. In the case of armodafinil, the dosage is 150 milligrams, and some of the side effects are listed on this slide. They include headache, nausea, dizziness, and insomnia.
Again, what this is going to do is lessen their drowsiness, which is a symptom that was going on with Janet. And Janet was also having some problems where she was drowsy on her drive home from work, and perhaps, as I said to her in the video, that drowsiness could be lessened by improving her situation using medication.
Precisely.
Yeah. So let's go to a summary of our treatment approaches. When somebody has shift work disorder, Carl, we've talked about the fact that they have insomnia. We've said that they have daytime sleepiness and also, of course, a circadian misalignment. We said as for the insomnia, sleep-wake hygiene is very important. Hypnotic medications can be used. Even melatonin can be used. And this can also overall increase sleep duration. We've also said that for the daytime sleepiness, naps are helpful, caffeine is helpful, and modafinil and armodafinil to increase alertness. And then circadian misalignment, again, all of this going on to optimize the circadian alignment. Carl, there are different types of shift workers, and some of them we can re-entrain a little bit better than others, right?
It seems so, and it's difficult at this point, unfortunately, with the scientific knowledge available to us to identify these folks ahead of time, but much of this is in the realm of genetic testing. But there are, in fact, genetic mutations or abnormalities that predict response to shift work. For example, some people who are more eveningness types may be less able to respond to the challenges and rigors associated with shift work.
What's the worst kind of shift work, and what's the least offensive type of shift work?
It's very difficult at this point to say that with a great deal of certainty, but some of the studies suggest that the worst kind seems to be the one which is sort of PRN shift work or as-needed shift work, where an individual is called willy-nilly at the whim of an employer to go into work and then come back to work. So there's no opportunity to plan ahead, to plan one's sleep-wake rhythm ahead. And of course, the best shift may be the one which involves a permanent shift on a certain schedule, for example, a permanent night shift or a permanent day shift.
And if somebody's doing a permanent day shift, let's say 11 to 7 at nighttime, when they come home for the weekends, should they also have an 11 to 7 schedule, or can they go back to a quote-unquote normal type of sleep-wake practice?
Of course, it's optimal to maintain the same sleep schedule on weekdays and weekends, but practically speaking, very few shift workers are able to do that.
Right.
So hence some of the strategies we've been talking about today.
But Carl, they're all shift work disorders, and we have diagnostic codes, and we have here 327.36 and on down, with 327.36 being the circadian rhythm shift work disorder, shift work type. That's the most common one that we actually use, and it's actually an ICD-9 diagnostic code that we can use.
Exactly, and I think the important point is that there are diagnostic codes for shift work sleep disorder. That is, we don't need to resort to coding these as insomnia, daytime sleepiness only, or whatever else
or even fatigue that we have up here.
Exactly.
Yeah. At this point, we'd like you to participate in a case study. This is very interesting because you have the choice of following either the case of a 55-year-old night shift emergency nurse who suffers from excessive sleepiness, or a 50-year-old convenience store night manager who is suffering from depression. Now, in order to obtain credit for this activity, you must complete at least one of the case studies. You may complete both, but it is not necessary for you to do so to obtain credit.